Welcome, everyone, to the Virginia Academy of PA's 2025 VAPA Fireside Chat. I welcome everyone. As people are getting logged in, we'll give everyone about a minute or so to get settled for tonight, and then we will get started going through our agenda. Just as a disclaimer for everyone that's here on time, we will use a Q&A feature. So if you have questions as we're going through tonight, just put them into the Q&A chat box. We will answer your questions towards the end of tonight's session after we're done speaking. So then that way everyone has a time to cover their material. Maybe we'll cover your questions as we're going, but if we don't, we'll certainly get to all of your questions as we're allowing that time at the end of today's session during that Q&A time. So again, just use the Q&A feature. In addition, I would like to point out that we are recording tonight's session for any attendees that might be late or joining after the fact, so that way they can watch tonight's session, as well as for any VAPA members that are curious about the content that we're covering tonight as it relates to PA advocacy within Virginia. So again, welcome everyone to the Virginia Academy of PA's Fireside Chat for 2025. I'm Blake Rogers, the Virginia Academy of PA's treasurer and chair of the membership committee. So I welcome everyone here tonight. And we will get started by welcoming some of the leadership that you see before you at the top of your screen. And we will kick off tonight with Vice President Bobby Cochran, just to give a quick executive update about the Virginia Academy of PAs and the presidents, vice presidents. Welcome.
All right, good evening, everyone. Welcome to our Fireside Chat. And I want to thank Blake for all of his hard work, first off, for putting this together and really providing this opportunity for all of us to connect with you all across the state so that we can share a lot of the work that's going on behind the scenes and certainly have the opportunity to answer questions. I think this is an awesome opportunity for you all to get to know us a little bit, but also to really get to understand how the Virginia Academy of PAs is really working behind the scenes to support you in many different ways. And so for those of you who are not members of VAPA, but are practicing here in Virginia, I strongly encourage you to, consider your membership. And as you may know, if you're not a member and you have registered for this, you do get a free membership as part of attending as well. And we hope that you'll take advantage of that and really participate in a lot of the things that we offer throughout this coming year, including additional fireside chats that we'll be doing along the way as well. So we have a lot to talk about tonight. So I don't want to take a lot of time in the welcome, but I do want to say happy PA week to everybody. And I'll pass it over to Devin first, and then I'll come back and we'll jump into some of the legislative updates that we have here.
Thank you, Bobby. Hi, everybody. My name is Devin Pizanza. I'm VAPA's executive director. If you are looking at the other panelists who are on this call, if you see Christy Connors and you email VAPA or call VAPA, one of us is answering you. So just nice to put a name with a face. I'm just going to take a second here to talk about our leadership and the membership within VAPA. So VAPA's leadership is made up of a board of directors, there's committee chairs, and there's regional coordinators, many of whom are either on your screen right now or who are joining us as attendees. Thank you, everybody who's here. These are the people who are here to support you. They're here to answer your questions. They're going to help you get the most out of your membership. And one question that we always hear is, what does my membership get me with VAPA? What am I getting out of being a member? So really, there's three areas that we focus on when we have our membership. The first is advocacy. That's a big part of what we do. And I know Bobby's going to speak about that next, but we are at the Board of Medicine and the PA Advisory Board meetings regularly. We have a daily presence at the Virginia General Assembly. We are currently awaiting the results of the Department of Health Professionals study on PA autonomy, and we expect a positive recommendation, and we plan to move forward with independent practice legislation during the 2026 session. We also have two ongoing regulatory actions that we hope will be approved at some point in 2026, and your membership helps us to back all of these efforts that we're making to help support PAs across Virginia. The second thing that we focus on is continuing education. Every July, we hold a week-long CME conference in Virginia Beach. We've listened to the attendee feedback and we've really changed the format to allow more time to enjoy the beach and also maximize the amount of CME that we offer. But it's not just education. We offer workshops, there's networking events. We have a trivia night every year that's been really popular. We have special sessions. We offer special tracks, and it's a really family-friendly location. So we're trying to find a balance between the beach and CMA, the beach and CME, and VAPA a discount on those registrations. And the third thing that we really focus on is networking and promotion of the profession. That's the three pillars that we have. So our membership is split into 8 regions. And like I said, we have a coordinator for each of those regions. You can find their information on our website, and many of them host events. They have dinners, they have happy hours. It's a great way to connect with other PEs in your area if you're looking for precepting opportunities. If you are looking to shadow somebody, reach out to those regions. They're going to have the most information for you that's specific to your area. We also have a free members only job board. You can post opportunities for free if you're a member. And our communications committee does a great job of keeping us active on social media. They're celebrating all the accomplishments of Virginia PAs. They're making sure members are staying in the loop on what's happening in the area. And starting today, actually, we've started hosting our annual PA program, social media challenge. It's always a lot of fun to watch. I know my Facebook notifications are going off because everyone's liking the photos. So make sure you're following that because the school with the most likes across all of our accounts does get a special advantage in next year's Student Challenge Bowl. So it's a big deal. So make sure if you have a favorite, you're liking their photos so that they can get some type of advantage for the Challenge Bowl next year. And we also host the annual VAPA Awards, and we do that at our summer conference. And it's just a great way to celebrate the work of PAs across Virginia. If there's anybody that you think is worth one of these awards, please nominate them. We nominate colleagues to go above and beyond in a number of categories. And it's really one of our favorite traditions because it's just about highlighting the people who really make a difference, the people who are working in education, who are humanitarians, precepting. There's a whole number of categories. So please, if there's somebody that you want to recognize, make sure you keep an eye out on the website for those emails and make sure you're nominating somebody. And that's really just my 2 cents. It's just a quick overview. If you have any questions, please don't hesitate to reach out to me. I'm going to put my email in the chat.
Thank you, Devin. And we will be turning this over to Bobby again to really cover the legislative update. For those that have just joined or joined live, I wanted to, one, wish everyone a happy PA week. Thank you for joining us. There was a question about viewing a PowerPoint. I am sharing the agenda that was sent out via email. And it looks like everyone can see that we're just following that agenda rather than having a PowerPoint. It's meant to be a casual conversation. That way you can follow along with us. And outside of that, I'll turn it over to Bobby so he can overview our legislative initiatives.
Thank you, Blake. Thank you, Devin, for highlighting the academy and really where we are now. I think we're really growing as an academy, and we're really working hard to make it the academy that you all want it to be. And so we appreciate the engagement and feedback and everything that you all are contributing to really make this as good as it can possibly be and serve you all well. So I want to touch on a number of things from a legislative standpoint that we've accomplished over this past year and really what's happening going into this coming year, as there's been a lot, quite frankly, that has transpired. And as Devin said, your engagement here really drives a lot of what we're trying to accomplish from a legislative standpoint. And I'm proud to say, quite honestly, the legislative victories that occur within the state of Virginia regarding PAs is largely due to the work of the Virginia Academy of PAs here. So this work is very important, and we all need your support to really make all of this happen as well. So this last year, we accomplished a number of really good things, and one of those was the compact that was passed. And I want to point out that Virginia was the 7th state to pass the compact, which actually activated the compact. And also proud to say that Kathy Scarbalis is one of the PAs that has been a long-standing PA in Virginia, previous president here, and is serving on our steering group for the PA Compact as that group really works on how to operationalize the compact. So you'll be hearing more about what's going to transpire with respect to the compact and getting that actually operational as that work continues. And so the other thing that we accomplished this past year was we had a bill that really petitioned the Department of Health Professions to do a study on PA practice as to when PA practice could be considered independent PA practice. At what point of experience is it appropriate to consider PA independent practice here in the state of Virginia? And so that was actually a bill that we had to get through the legislative process last year. And we were able to get that bill through despite a lot of hesitations along the way from the legislators, as there was a lot of initial sort of hesitation and pushback in getting that through, but we were able to get that through with a lot of work. And the Department of Health Professions did complete the study. We just got the results of the study a few days ago, and I'm happy to report that it is a positive finding as we expected, and we will be able to use that study in drafting our language for independent practice for PAs across Virginia, which will be our bill for this fall or this legislative session upcoming. And so there will be more that we will talk to you all about with respect to that bill and what the language really will be regarding that bill with respect to how many hours of experience you will need and how, really how it will impact you as far as PA practice across the state. We do, and I want to point this out, work very closely with the Medical Society of Virginia. They have been great partners with us, and we will be working with them in partnership to draft our legislation, as they are very influential in the legislative process throughout the state as well. So it's very nice to have them as partners, and so we'll continue to work very closely with them as we draft our legislation. And so the legislative climate this year is extremely up in the air. And the reason that I say that is because, as you all well know, we're approaching November elections, and this year in Virginia, there is a lot up for deciding in these elections, including our governor and most of the House, as well as many other legislators in the House and Senate. So this is going to be a very big year with respect to our potential leadership changes within the legislature. And so these elections are going to be really, really important. I mentioned that because much of our work will really have to start, much of our work as far as connecting with the individual legislators, talking about our bill and really lobbying for our bill, will need to happen after the elections, after we know who's actually going to be in power in various different seats and committee leadership after the elections as well. So there will be a lot of work to do. One thing that I would strongly encourage all of you all across the state is to find out who your local representatives are, get to know them, and when we start to communicate out what our legislation is going to be, what the language for our bill is going to be, I would strongly encourage you to share that with your local legislators and tell them how important it is with respect to PA practice in Virginia. And it's really that work that really makes the difference. So I strongly encourage you all to do that. I also we had a number of questions that came in prior to this, so I want to touch on a couple of things that Devin briefly mentioned in the beginning of this as well. And we had a couple of regulatory initiatives that have been actually in progress for the better part of a year to a year and a half. And there were really two things that we were focused on. One was the removal of the need for a physician to be on a prescription for a controlled substance anytime a PA writes that prescription. As you all well know, this is pretty antiquated legislation, and it really does cause a lot of trouble for PAs across the state trying to prescribe, and particularly as we work more and more autonomously in general, this just really gums up our ability to deliver efficient patient care and top-notch patient care to our patients. So we proposed regulatory change that would remove that requirement. And so just to give you all a quick update of the different steps that have to take place in order to make that happen, any sort of regulatory changes. If you go to the Virginia Register of Regulations, it'll actually explain this process, but it's basically a three-step process. We would submit a notice of intended regulatory action. That was done and actually passed through that process. Then we had a 30-day period where it was open for public comment. And that public comment, we had appealed to many of you all at a previous fireside chat and meetings to really make sure that you comment on, how this regulatory language impacts your ability to provide care. And we had very good comments on there, so I appreciate any of you that did so. And so it made it through that very positively. The Attorney General signed off on it, and it's actually been submitted to the Department of Planning and Budget. And it's sitting currently with the Department of Planning and Budget. After they certify, what sort of financial impact this may have, which really will not have any financial impact, it will go back to a public comment period. And this could be a 60-day public comment period. And then after that point, it goes to the secretary and then the governor. And so I'm glad to report that we have made it a number of steps down to the Department of Planning and Budget with this. And really the next steps are this public comment period and then on to the secretary and the governor. So I'm hopeful that this will be changed in 2026, hopefully in the next 6 months or so. But I wanted to make sure that you all were updated on that. The second regulatory change that we had proposed was around removing the language that required a physician to be involved in the care of a patient that was seen by a PA more than twice without improvement in their condition. And we wanted to change that legislation or that regulatory language to really say that the opportunity for the PA that's seeing that patient to refer them to a physician really should be at any time. It should not be dictated within regulatory language that we have a certain time that we have to refer them. It really should be up to you all seeing the patient. And so that actually has gone through the public comment period as well, and we're waiting on that to be submitted by the Attorney General, then to the Department of Planning and Budget. So it's just a little bit behind the regulatory language with the prescriptions. But again, I'm hopeful that will continue down the process. We had very good public comment on that as well, and I see no reason why either one of these should not proceed to the end, as we've had a lot of support, not only from you all, but actually from Board of Medicine and others. So then just to comment again on our upcoming legislation, as I mentioned before, we work very closely with Medical Society of Virginia. Medical Society of Virginia does an awesome job coordinating lobby days for PAs and medical students, PA students, as well as practicing physicians across the state of Virginia. And this partnership is really, really important. They, as I mentioned, are very influential, and they've been very welcoming, quite frankly, to PAs across Virginia. And so one of the things that we do to support the Medical Society of Virginia, but also get our name out there as practicing PAs and PA students, is to participate in lobby days. And the Medical Society of Virginia, if you go to msv.org, on their website, you can look for events, and you will see lobby days that are scheduled for 2026. Generally, the lobby days are scheduled in January and February, and it's an opportunity for practicing PAs to be coupled with practicing physicians and to lobby for legislation that is impactful to our practice across the state of Virginia. They set up appointments with various legislators, and we will meet directly with them and lobby with them regarding the legislation. We are doing our student lobby days a little bit differently this year than we've done in the past, and I'm happy to report the reason for that is because we've had a tremendous growth in the number of students that are attending our lobby days, and we want to make sure that we support them in a meaningful way. So what we are doing, we have dates that have been shared with the individual schools, and we will be having a lobby day specifically for the students where we'll give the students some experiences with where they will be able to see the General Assembly building. They'll be able to see what a committee hearing looks like. And then we'll give them the opportunity to also meet with a few legislators that will come and talk to them about the process, and the students are able to ask them questions and also voice their feelings about PA practice in Virginia as well. So we're thankful to be able to do that for our students, and I think it's going to provide a great opportunity for them to see the process and be involved even as a student as well. But if I can put one more plug in everybody's ear, this legislative session is going to be very, very important, and I really want to make sure that we have a lot of people involved. As I said, us moving forward with a bill regarding independent practice for PAs that really puts us on a level playing field with our nurse practitioner colleagues, which is so important in order for us to be competitive in the job market these days, and to really be able to practice in the way that we were trained. We need people to participate. And so again, meet your local legislators, talk to them about the legislation, but also please plan to participate in lobby days because those can be extremely helpful as well, as we are also working alongside the Medical Society of Virginia to support them as well. One other thing that I'll touch on is title change. There were a number of questions about title change and what's happening with consideration for title change. And so what I will tell you is that in the state of Virginia, what we had to do is we had to decide, is it going to be better for us from a political standpoint to first pursue title change or first pursue independent practice? And it was very clear from the feelings of various different groups that are influential across the state that it was going to be better for us to go for independent practice first and then have title change as something that we pursue after that. And otherwise, we were going to be hung up in a legislative process for title change. I think that we're in a good spot, and I think that we can continue that conversation about title change and really work a number of different avenues to be able to achieve title change as some other states have, and we're learning from them too in how they've done so. And so that is certainly on the docket. I know that that is something that's very important for PAs across Virginia, as it is for me. And we do want to accomplish that for you all, but we have to do it strategically. And I want to make sure that we do it in a way that we're going to be able to get it across the finish line. I also just want to really quick mention our political action committee for VAPA. So if you go to the VAPA website, vapa.org, and you look at the link for advocacy up at the top, you will see a hyperlink for the political action committee. I mentioned this because just to tie all of this up, as you all well know, there's a lot of work that goes on behind the scenes to make these legislative and regulatory changes. And that does not come without important donations that we get from the political action committee. So please go to that site. If you have the ability to donate anything, please do so. And rest assured that your donations are going to be used to support PA practice in Virginia. And so if you have any questions, of course, about the PAC, I'm happy to answer those at the end as well. And I will turn it back over to, next is going to be Kim.
Hello. Hi, everyone. I'll start it like everybody else. Happy PA Week. I am Kimberly Sapre. I am the VAPA Chief Delegate, and I've been the Chief Delegate now for a couple of years. And for those who are not aware of what that means, so the VAPA delegates are delegates that attend the AAPA House of Delegates meeting. It is a House of Delegates meeting that occurs during the AAPA conference every year. And the whole purpose of the House of Delegates is that it's a body of constituent organizations. So organizations such as the Society of Emergency Medicine PAs, state academies are a part of this, such as the Virginia Academy of PAs, and the Student Academy. So what we do is we get together to create policies and position statements that go into the AAPA policy manual. So each year we have delegates that represent the Virginia Academy of PAs at this meeting that occurs during the annual conference. And so I wanted to just give an update on the work that we did during our last conference this year and to kind of let you know what we have coming up as well. So this past year, we had 7 delegates that attended the AAPA House of Delegates this past May. And during that during that meeting, we did have some representation on committees from the Virginia Academy of PAs. Before even attending the House of Delegates, we had one of our delegates, Josh Dietrich. He sat on the Standing Rules Committee. So it is a committee that meets to review the standing rules that we use during the House of Delegate meeting. During the House of Delegates meeting, I served on a reference committee. A reference committee is a type of committee that sits and listens to testimony during the actual meeting. And our job is to write a report to submit back to the delegates so that we can do voting on our last day. And so each year, when we have our delegates go, we always have very good representation from the state. For the last several years, we've had 7 delegates attend this meeting for representation. Outside of just the leadership that we had on committees, we worked as a delegation to also collaborate with other state academies. We played a significant hand in helping to pass 2 significant resolutions that have now been written into AAPA policy. One of those resolutions that we had on the floor related to removing opposition language related to the entry level doctorate degree. And so now we no longer have within the AAPA policy manual any opposition to an entry-level doctorate degree. So this pretty much kind of opens the door for any programs that are interested in possibly starting an entry-level doctorate program. Furthermore, we also worked with several state academies, and these academies that we worked with were from Texas, Washington State, Oregon, New York, just to name a few. So there's a large group of us that collaborated together on these 2 particular resolutions that are now policies. Our second resolution that passed and has now become policy is related to just the AAPA recognizing the rigor of uh, the PA work that we do, just even in the master's program. And a committee will be formed to study a pathway into the entry level doctorate pathway. And so it is an expectation that the House of Delegates is going to receive a report from this AAPA committee that's going to be formed during the House of Delegates meeting in 2027. So not the upcoming meeting this next year, but 2027, we are expecting a report of them laying out a possible pathway into an entry-level doctorate program. So these are two big resolutions that have now become policy that the Virginia Academy of PAs played a huge role in helping to pass. So that is what we did this past year. We also hosted a meet and greet. It happened on Sunday evening. And so during our meet and greet, you have a chance to talk directly to the members of the House of Delegates and also the board members. So during that meeting, we give an updated legislative updates. So similar to what Bobby has given right now during that meeting at the conference, we give even additional updates, things that have happened since hearing Bobby speak now. You also get a chance to ask the delegates what occurred during the House of Delegates. So our upcoming House of Delegates meeting is going to occur during the annual AAPA conference, which is going to be May 15th through 17th for the House of Delegates specifically, and it will be in New Orleans this year. So nice place. And so if you are interested in the work that we do during the House of Delegates, it is open for any PA to come and attend, listen to the testimony, give testimony even on resolutions that you may hear about, or you can tell us some things that you may want us to talk about or give testimony on related to any resolutions, and we can work on that for you. Also, we're going to be hosting another meet and greet during this upcoming conference next May. It's going to be on Sunday again at 6 p.m. So if you are attending the annual conference, please join us during the House of Delegates or even join us for the meet and greet. Furthermore, we as a delegation, we work to take resolutions to the House of Delegates. At this time, we are not working on a specific resolution or resolution topic right now. But if you have a topic that you think should be a part of the AAPA policy manual, you're not sure if it is in our policy or not, don't hesitate to reach out to me. I can always take a look at our policy manual, see if we have anything related to it. If we don't, then we can work together to write a resolution and take that to the House of Delegates next year. As a heads up, if you're interested in something along those lines, our resolutions do have a due date. So we have to submit these resolutions by, if it's related to a bylaw resolution, has to be submitted in February. If it's a non-bylaw, has to be submitted by March. So anyone who may be interested, please submit it my way sooner rather than later. That would give us a chance to do research to see, once again, is it part of the policy, or is this something that we could actually write up and take to the House of Delegates for next year? And so those are my updates for the Virginia House of Delegates. Thank you, Bobby.
And thank you, Kim. One of the things tonight that I really want to champion, as we've heard from Devin, Bobby, and Kimberly, is really making sure that we're forward-facing for our membership. And that's been a real priority for us to make sure that you're aware of what we're doing from an advocacy standpoint, because we want to represent truly you as a PA working in Virginia and making sure that you're able to practice at the top of your license, not only from a legislative standpoint, but we're also representing you and your voice within our national organization. And we've positioned ourselves in a spot where your leaders are there to make sure that we are truly representing your voice. And we need you at the table. And so my membership update is really going to talk about where we're going and asking for your assistance in making sure that we're bringing everything that we should be to the table as your leaders. So when we got the report that Bobby had referenced from the Virginia Department of Health Professions, as well as what I know from the ongoing database, there's just over 5,000 PAs with active licenses in Virginia. right at 5,100. When you look at that, there's about 10% of all active PAs in Virginia are members of VAPA. That's kind of a staggering number. But when you look at side by side sister constituent organizations, that number actually is pretty consistent, if not towards the higher end of PAs and in similar states joining their constituent organizations. Clearly, we would love for every PA in Virginia to be a member of VAPA, because then we can collectively say that we're hearing what the will of PAs in Virginia is. But we need your help to do that. We don't want to go out of our way and say that we're over here advocating for you if we're missing the mark. And so your membership really does mean that we're getting to hear from you. You're having a seat at the table, and as we're going to these boards or having these discussions, we get to make sure that your voice is really heard. And tonight is just one of those examples. As we're going to be going forward and making sure that we're advocating for these legislative changes, it's really important that your membership is here, and that you're also helping us advocate across the state. Certainly, you have peers, you have colleagues that may or may not be members, and I can certainly speak to my first clinical practice. There were 9 PAs, and I was the only VAPA member. And I did everything in my power and my will to make sure that my colleagues knew and had an opportunity to not only join that conversation, but become members of the Virginia Academy. And it only takes one person to kind of bring up that discussion, like, hey, are you a member of the Virginia Academy of PAs? And we're more than happy to extend and have sessions with your employer, with your workplace, to really make sure that you're getting that opportunity to hopefully maybe reimbursed for your VAPA membership, but also that these discussions can be brought to the forefront because your membership is important, your voice is important, and advocacy is important for PAs in Virginia. So as we're moving forward, I really want to highlight some of the committee work and recognize the individuals that are the leaders within the Virginia Academy of PAs that are getting this material put together, that are having these discussions and representing you. And we'll start by overviewing the committees. These can all be found on the VAPA website. In total, we have 8 different committees. And those are the Advocacy and Outreach Committee, chaired by Shola Ilago. We have the CME Committee, chaired by Angela Conrad. The Government Affairs Committee, chaired by Bobby Cockrum. The Marketing and Communications Committee, which I chair. The Membership Committee, again, I am helping chair that. The Regional Coordinators Committee, which Alex Patton chairs. The Reimbursement Committee, Emily Waller chairs. And then the Student and Early Career PA Committee that Alicia Rokiki chairs. If you are interested in joining these committees or taking the next step in your membership and helping with one of those groups, I encourage you to reach out to me, to Devin, to Christy, any one of the leaders that you see tonight, and say, what can I do to become involved? Simply a little bit of your time actually goes a long way. And it really makes sure that within this team of leaders that you have, that we're getting diversity brought forward, and we're making sure that you have that seat. We want to encourage the next generation of PA leaders within the Virginia Academy of PAs. And so don't hesitate to reach out. Don't hesitate to ask us. We are more than happy to have a conversation about how you can become more involved. In the email that we'll follow up with tonight, you'll get more information about becoming a member, that coupon code that we talked about for discounted membership if you're already a member, or free membership if you have not been a member within the past year. And outside of that, send me your emails. I'm happy to have a conversation with you. Please know that you can continue using the Q&A feature, and we'll answer those questions as we're nearing the Q&A time. But for the last section of tonight's agenda is turning this over to Alicia to have a conversation about one of our newest initiatives, which happens to be the Early Career PAs. Something that is also near and dear to my heart, and I know that it is hers. And we really would like to be able to say that we have a spot for every PA, regardless of experience, students at the table here within the Virginia Academy of PAs. So Alicia, I'll turn it over to you.
Good evening, everyone. And again, happy PA Week. I'm so excited to be here and talking with all of you about this topic, which is very much near and dear to mine and Blake's hearts. This is the newest position that we had added to the board of directors just this past year. And so I am very excited to get this kind of off the ground and running. So just as background, I graduated from PA school in Virginia. I graduated from South University in 2022. I am fellowship trained in critical care medicine, and I now practice in cardiac surgery up in Northern Virginia. And so I've been with the Virginia Academy of PAs since I started PA school. So just about 5 years now. And so this role really has the goal of advocating for the early career PAs. There's a ton of new learning that you do within your first 5 years of practice. And so we're really trying to bridge people through from the transition from schooling into clinical practice and how to do that smoothly with there will be some bumps, and I promise you we'll make them through, but VAPA is trying to make them little bumps and not big hills for you guys. And so with that, some of the things that I do is just maintain things with regards to the advanced clinical training programs in Virginia, and so keeping in touch with program directors and things like that for residencies and fellowships. I host quarterly discussion meetings, so be on the lookout for links to register for those. And down the pipeline, hopefully soon, will be an early career PA day, which will be a virtual day for some CME with lectures specifically relating to the early career PA. Tangentially, I also co-chair the student committee. And so I get these early career PAs before they're even early career PAs to establish a relationship with them and a good rapport so they know how to get in contact with me after they've graduated if they have any issues. So also feel free to check out all of our PA students on the social media challenge this coming week as we celebrate PA Week. And be sure to vote for your favorite posts to help them win. If you would like to get involved, my email is available on the vapa.org website. And if you have interest in mentoring an early career PA, I would actually recommend you go to the AAPA website. They have a way to sign up and to match with an early career PA. So definitely take a look at that too. And reach out to me with any other questions. Thanks, everyone.
Thank you, Alicia. And so we'll turn it over to the Q&A session, and I will kind of be the narrator for some of the Q&As that come in. And so the one that I just saw come forth was asking if the leadership could explain to everyone about the Virginia PAC contributions and what they are used for. If PAs don't contribute much, do we get less lobbying? Or do these funds supplement on top of paying our lobbyists? And I will turn this over to initially Devin and Bobby to kind of explain those contributions. It's certainly been something that, since I've been a leader here, has been something that has developed. And those funds do directly go to our efforts, but I'll let them explain that a little bit more.
Sure. Yeah. I mean, Bobby, you might have a better say on it, but the funds that we do collect them from membership. We have the donations, as Bobby mentioned. And then there are certain contributions that we make to candidates. And Bobby, I don't know if you want to speak more to that, but that is not paying for a lobbyist or their services. VAPA gets the same service from our lobbyists no matter what contributions we have.
Yeah, so I think it's really important to understand that we don't use those contributions to pay for our lobbyists. Those contributions are really used to, make donations to individual legislators that are going to support or would be important to have as, a partner with our legislative efforts. As you all well know, or if you've never really been involved in political process, it can be it's a very convoluted process, and there are lots of um, donations that come in from organizations across the state to get legislators to support the legislation that those organizations want to get through. And so we use those donations to actually do that as well. And it is very, very important because as you know, we're a relatively small group, and so our ability to give donations is very limited, except for the funds that we have from the PAC. So the PAC funds are extremely important. So what's the status of on PA full practice authority be similar to NP status? So I touched on this just a little bit with respect to the legislation that we're pursuing this year. And it really is, last year we had to submit the bill for the Department of Health Professions to actually do the study. This year is going to be the actual bill for independent practice. And so we're in the process right now of working with, again, the Medical Society of Virginia and drafting our legislation and what that's going to look like. But the intent is that we want to have a bill that is really going to put us, as level as we can be with our nurse practitioner colleagues for independent practice here in the state of Virginia. And so, very important, very, very, very important bill. And so, I really hope that everybody will participate in this process this year.
Thank you, Bobby.
Yep.
We have a question about the being able to view the report to the legislature that you referenced. We received the GHP report, and we were told that it was published. And I'm assuming that that will be then posted on a state website soon, if it has not been already. And I know that they will be delivering the formal report by November 1st, 2025. I don't know if you have more specific information than that, Bobby. I don't know if we are allowed to directly release that until it's publicly available on a website, but
yeah, I'm not sure that we're allowed to directly release it. I will find out, but there will be a formal report that's released. What I will say is, just from the report itself, largely focused on really, NP practice in Virginia and the training of PAs and how our training is accomplished compared to NPs, and really that there were no increases in malpractice and adverse outcomes, things like that, in states that had allowed progressive PA practice or more independent practice for PAs. And they highlighted the states that had already achieved independent practice for their PAs. So I think it was a positive study. There's from all of those standpoints, and but there's nothing in it that is negative from a PA standpoint, and I think that's really, really important. And I think that one of the most important points with respect to this study is the fact that we did it. And there are a number of legislators that are a lot more likely to support our bill just simply because we went through this process. And so while, I admittedly in the beginning was not a big fan of going through this process and delaying the legislation a year, I think it really did us a lot of good to be able to do that. It also, helped us to partner with MSV more with this, and I think that it sets us up for hopefully getting it across the finish line this fall or early 2026.
Thank you, Bobby. We had a question regarding the supervising physician's physical location being the same for controlled substances. And I believe that's part of, we're working on the regulatory changes specifically for that. Bobby, I know you're just shaking your head, and so I'll kind of turn it back over to you.
Yeah. So, yeah, the regulation itself does not have a restriction with respect to the location. What I will tell you is that unfortunately, and this is one of the reasons why we really want to get this changed, is that pharmacies across the state have interpreted this regulatory language their own way. And they have sort of run with it based on, you know, however they want to interpret it, quite frankly. CVS really started this. I've been a PA for, 25 years. Crazy. But yes, 25 years. And I never had to deal with this really up until a couple of years ago. And it was largely started by CVS, some of the big box pharmacies like CVS and Walgreens, and then it has spread to Walmart and Sam's and Costco and even some of the neighborhood pharmacies as well. And what I've been told is each individual pharmacy has, most of them have software that they use as proprietary software for their company, CVS, for example, and they have developed a little qualifiers. And while the regulatory language does not require a location, it also does not require the physician's DEA number. It doesn't require their NPI number. It doesn't require anything outside of the physician's name. Even though that's what the regulatory language says, the pharmacies have actually interpreted it many different ways, including some who are saying we have to have the physician's DEA number, we have to have their NPI number, some have to have their location, some have to have, some have even applied this to NPs as well, and NPs are nowhere in the regulatory language. So all I can tell you is that, this is why we're trying to get this removed. And I would encourage you to reach out if you're having those experiences and share those with me, because, as we get closer to when it's on the secretary's desk and it's really in front of the governor, any sort of stories really allow us to put more pressure on the process as well.
Thank you, Bobby. The next one was, are you able to share the proposed bill for independent practice that will be presented at next year's legislative session? We will share that as soon as we have that together with VAPA membership, as well as talking points that could be kind of the quick bullet points, is like a one sheet, like what should we do, say, how will it be presented? So yes.
Yeah, absolutely. I think that's an awesome idea, and we will definitely share the language of the bill once that is finalized, just like Blake said. And we're happy to put together some talking points that you all can share with your local legislators as well, because that's going to be really, really important.
The next question, kind of related to that, has MSV fully endorsed full practice authority?
Yeah, so what I will say is MSV is taking a position that they are supportive of us throughout this process, which is actually huge, because again, they are very influential in the process, and they actually asked us to go through this DHP process, and so they have been supporting us behind the scenes with all of this, and to the point that we're actually working with them again and drafting our legislation. And they're going to be influential in talking to legislators about our legislation, and really their hope that this gets passed as well. So they are not, I will say they're not out advertising that they're supporting VAPA in PA independent practice, but they are definitely supportive of this and have been supporting us behind the scenes for quite some time with this.
And again, PAs can be members within MSV.
Yes, absolutely. And if I can take 1 second and plug that opportunity as well, I think that's really, really important. So if you go to msv.org and you can join as a member, PAs can be members of the Medical Society of Virginia. And there are tons of opportunities for PAs to get involved with the Medical Society of Virginia. And so I strongly encourage you to do that as well. These are the things that really help us with PA practice across Virginia. VAPA membership, VAPA contributions, MSV membership as well. It really does make a difference.
And again, I know Kathy is on this meeting, but a huge shout out to Kathy Scarbalis, who has helped blaze this trail and part with some of her colleagues to get us in the position that we're at with this strong relationship with MSV.
Yes.
And so, we'd be remiss to not say thank you to those that have got us to this point. And Kathy is still here and championing all of the PA's efforts within MSV. So, Kathy, while you might be able to speak, thank you. The next question is, are there any definite regulation or if a physician has to be in an outpatient office or a PA doing a minimally invasive procedure? So does the physician have to be in the office while a PA is doing a procedure? And I think that's set at the practice level.
Yeah, that's at the practice level. There's no regulation that actually says that they have to be present. Really from a procedural standpoint, if you all have been a PA in Virginia for a long time, there's been multiple iterations on how we got the ability to do, procedures. And it used to be that we had to submit information to the Board of Medicine, and they would actually approve us to be able to do procedures, and you had to have that approval before you could do them. They've changed all of that, and it's really regulated at the practice level. And so if your practice has a process where they quote approve you for doing those procedures or train you to do those procedures, there's nothing from a regulatory status that says that you have to have that physician in-house in order to do that.
Thank you, Bobby. And then Dave Falkenstein, who is probably one of the original PA advocates in Virginia, asked a question to just general, how do you find out who your legislator is? And that's such a great question because I think everyone needs to know that. There's a state website that we can link that you can just put in your zip code. You can locate exactly who that individual is. And as part of our outreach, marketing, and what we'll be doing is really targeting that so you can actually connect in. We have a subscription service. It's called Muster. That when we're getting ready to launch this, you will get a template that will essentially be able to say, here is the template email I can send directly to my legislator based upon my geographic location. And this will automatically do that. So we have features and tools available that when we're ready to launch our initiatives that back this, we will have that for you. This is just the strength of your VAPA membership. And again, thank you, Dave, for getting the Virginia Academy of PAs off the ground. I don't see other questions, but we are almost at time. And what I would like to do is just thank everyone, all of the VAPA leaders that are here tonight, and making sure that I think all of the Virginia PAs that took just a little bit of time, an hour tonight, to hear what we are planning, where we are going. All of your leaders are excited about this effort, what we will be doing to move forward practice for PAs in Virginia. We care about this work. It's meaningful. And it takes the collective to be able to accomplish everything that we're looking at. So thank you for taking that time. I applaud everyone. So last question that I see in here is there any chance in the future to have full reimbursement for APPs instead of 85%? That's on a national agenda at a federal level. And so that's always being looked at. I think that is a regular thing that at least at AAPA is something that's on the radar. So And I don't know if any of the other leaders have any other updates about that. That's not something that I have seen more recently pressing, but I know it's on the national agenda.
Yeah, absolutely on the national agenda. I'll just comment really quickly. I think this is going to become more and more of a conversation in the next couple of years. As you all well know, there have been a number of moves by CMS to really try and understand how PAs are actually and NPs are actually practicing across the country. And that is, I think, going to lead to these conversations around what does reimbursement really need to look like, particularly in the context of PAs and NPs having more and more independent practice.
And we have a live answer that AAPA Reimbursement Committee does have a good working relationship with Senator or CMS. So thank you to everyone. We will end the recording. We'll follow up with an email with some of these important links, and we look forward to our future together. Thank you. Happy PA Week.